My name is John Warner. I'm the Director of Marketing for MTF Biologics, and I want to thank you all for taking time out of your personal days and joining us tonight. Tonight, we're going to have a 1-hour program. We're going to learn about Renuva for use in the face. And just so that you know, there will be time for Q&A at the end. So during the presentation, if you could please use the chat feature to enter any questions, and then I will address them towards the end. But first, I'd like to share a little bit about MTF Biologics. We were founded 36 years ago by surgeons in search of healthy and safe tissue to implant and to transplant at a time when there was no guarantee that tissue would be safe to implant. So these surgeons set out to create their own foundation, a 501c3 nonprofit tissue bank that is today run and guided by surgeons, setting our policies, our standards in search of the highest quality tissue, but also the highest standards for processing to ensure the integrity of the tissue for optimal patient outcomes. MTF Biologics, we save and heal lives by honoring the donated gift, serving patients, and advancing science. So as a nonprofit, we take all those dollars that we make and reinvest it in R&D to come up with new and innovative tissue forms. We provide grants for research, and we also fund mission trips to help others in other areas of the world in need. But let's stop just for a second, because without these individuals, we just couldn't do what we do. Through the gift of tissue donation, we're the stewards to help process tissue in a respectful and honorable way. And we always want to make sure that we don't forget from where this tissue comes and how many people it can affect. You know, one tissue donor can save and heal up to 100 lives. So tonight, it's my pleasure to introduce elite injector Lori Robertson, who, as you can see, has many accolades, but needs no introduction. So it's my pleasure to introduce Lori Robertson. Lori?
Thank you. Thank you so much, John. I appreciate it. I am really, really excited to be here. This is a product that I truly believe in. It's a treatment that has really helped so many of my patients, and I'm really happy to be here to share my personal experience with it. And actually, after we're all done with this webinar, I'm actually going to do someone after this webinar. So it's something that I truly believe in, and I really have enjoyed a lot. If people know me, they know that I am somewhat more of a more cautious injector and trainer. I'm a little bit more on that cautious side where I'm not the first person to adopt things. And I kind of want to learn about it and see results first. So Renuva was one of those. I kind of waited back, and I kind of looked and I watched, and I wanted to make sure there weren't problems with it. I wanted to see what the product was all about. And what was really touching for me was I was able to go out to MTF Biologics building out in New Jersey, back east, and really kind of go through that and really understand Renuva's mechanism of action and how it works, how it's made, what the processes that go through this to make this and make it something that's safe for people to get. And the fact that it comes from donors and it comes from people who have gifted themselves to help other people in many, many different ways. Like you mentioned, 100 different people can benefit from one donor. And ask me if I'm an organ donor. Absolutely, I'm an organ donor. I always say, don't take your organs to heaven. God knows you need them here. So I think that it's super, super important. When I went to MTF Biologics, I really saw what it was as far as the buildings. And when I walked through the hallways, this is what I saw, you guys. On the top left, you see that quilt. That quilt is something that the families have made to memorialize or remember their loved one who donated. So when you walk down the aisles of this building, many different aisles, you see these beautiful quilts that people have made, and there's names, and sometimes there's pictures on them. And it makes it so real. It's very, very touching. It's very humbling to see something like that. And it helped me understand the core values of MTF and where MTF is coming from as far as honoring that donor. And when I say honoring, make that a capital H, because it is priority with this company, and I respect that with all my heart. The pictures you see kind of at the bottom are on the right side of the hallway. And John will attest to this because he's there a lot. But those are the people who have received some of their donations, some of the tissue and donations. And it's wonderful to see through donation, other lives can be changed and saved. And it's something that really touched me, and it helped me really believe in the products. And there's a donor garden out there that you can walk around that kind of shows the circle of life in essence. And it's something that's really, really special. This is a video that kind of shows the fat and what our fat is. Basically, if you think of fat, the fat is harvested from the donors, and it is processed. So the matrix is what's left behind. The fat is what we want to grow into that matrix. So the only thing that we are injecting as injectors is that adipose allograft matrix. That is a sterilized matrix that goes through a rigorous process to remove all the DNA. We inject it into the body, and it helps our body grow fat onto this product. So this treatment is something that really helps to grow our own tissue. And when people lose fat, why not help them get that fat back? We have a lot of different products on the market doing a lot of different things. We have fillers, we have all kinds of things. But as we age, we lose fat. We lose a lot of deep fat pads, and our fat thins down. So why not put something in that actually grows our own fat back? This is something that's natural. And I can tell you that, I don't know about you guys, because I know I'm talking to all elite injectors out here, but I don't know about you guys, but I hear a lot more patients nowadays really wanting something natural. They're not into a lot of the stuff that they were years ago, and they don't want to be overdone. They want to be very natural. So this is something that's really hit home base with myself, with my patients in my practice, and I'm sure you're going to see that, and you probably hear that in your practices too. So I want to show you a little bit as far as a face treatment with Renuva. And this is a patient that is someone that I just have grown to know and love because I was able to inject her. But she is in the mid-age, I should say. And we really see when someone's thinner and they've been a model all of their life that, you see, and a marathon runner, we see that volume loss. We see that loss that happens as we age. And it shows most in our face, but we see it a lot in our hands, which is where we put Renuva. And we put in a lot of other areas of the body too. But the face really shows it because that's what everybody's looking at. It is one of the most noticeable areas because when we talk to somebody, we're looking right at their face. We're looking at their eyes, their cheeks. We're looking at all this stuff. Don't judge. Don't judge. I need my Renuva. But we have always had soft tissue fillers and such to help this. And now we have something to put something back in that's a treatment that will help get that fat back in there. It actually works very slowly. And if any of you use biostimulants, you'll see that it works very slowly, and we just let the body do its thing over time. Renuva, we will see the results over 3 to 6 months. When I say 3 months, we see about 80% of the results. And at 6 months, we have about 90% of the results. So we kind of see between that 60 to 90%, we see that kind of growing as the patient matures in the months along after we've treated them. So we can kind of ascertain usually I'll do 1 or 2 sessions, and I sit back and I let them go for about 6 to 8 months. And I want to see what their body's going to do, how their body's going to respond to this. Everybody responds differently when we put anything that's going to stimulate their own system to grow something, right? The older we are, the slower we grow, and maybe the more sessions we need. So it's going to be very much patient driven with something like this. But the big thing is we are going to help grow something that they have lost through the years. So as far as face anatomy, I think it's really, really important that we know face anatomy when we are injecting our patients. And this Renuva can be placed anywhere fat did or does exist. There are a lot of planes of the face where fat exists or used to exist. So this can really be put in any of those sub-Q areas to help give them more fluff. These can be anywhere in the mid-face, superficial fat, deep fat, lateral face, and it's really important to kind of know the planes of tissue and where we need to inject this. Because if you inject this into a muscle, it's not going to do anything. If you inject this into the SMAS, it's not going to do anything in fibrous tissue. We have to put this where fat is or was. That's the most important thing about this. As far as fat compartments of the face, hopefully, I think we pretty much know this, but I'm just going to go through it anyway. It's really important to know where the deep and the superficial fat pads are. So when we have the deep fat pads, we are looking at most of what we're doing are the deep medial cheek fat pads. This is the majority of what we're filling with our patients. This is an area I love to put Renuva because it helps give more fluff to that deep compartment, which is the majority of the suspension and the support for that nasolabial fold. So if we can get that deep fat pad suspended and fluffier and get more fat growing in there, then we can get a lot of this upper area suspended. If we put it into the superficial fat pad, which you see here is the nasolabial fat pad, the middle cheek fat pad, if we put it here, it's going to give us a little more contouring. So think of it as more frosting, and deeper, think of it as the cake. So think of it as like we want to get that cake in there first, get the support in there first, and then we can kind of put some on top to give you a little bit of frosting. We can put it in the lateral area. You see a lot of lateral preauricular superficial fat. This is a beautiful area, and the submalar area, beautiful area for Renuva, because a lot of us get too thin there as we age and we start to look too thin. If people like to look pretty thin sometimes, and I want to caution about that, because if you look at a youthful face, you're going to have youthful fullness. And when some patients come into me and they're like, I want to go get a facelift, and I go, no, you need some volume first. Because if you just lift the skin over bone, you're not going to look youthful. You're going to look windswept. So it's always really important for us to get volume back into our patients, and it'll help that facelift look even softer and more realistic and more natural if they have the softer look of youthfulness. I kind of want to go through a little bit where and when not to inject Renuva. And I want you to just remember where I said as far as fat pads. And there's a lot to choose from in the face. You have a lot to choose from. Just know where they're at and where the planes of tissue are. Don't inject in the SMAS layer. Pretty much anything we put in the SMAS can lead to issues. We know that if any dermal filler goes in the SMAS, you're going to get a nodule. So I haven't had a problem with Renuva, but I don't want to go there. We just want to make sure that we stay in the fat pads, not in the fibrous tissue. You don't want to go intradermal because you're not going to build fat in that dermis. You don't want to go intramuscular. So some people like to put things down deep in certain areas, and if it goes into muscle, you're not going to build fat there because we don't have that scaffolding. We don't have the genetic capabilities to build fat in that area. And we want to make sure that if somebody has a current infection, if they've had a recent vaccine, if they have a high bacterial load, and I'm talking about just going and get their teeth cleaned, that we don't want to do injectables on those people because it might hasten an inflammatory reaction and a problem. So we want to let those calm down. I always wait a month before or after teeth cleaning, dental work, vaccines. If they have an infection, they've got to be off antibiotics for at least a couple weeks to make sure the antibiotics worked. And then I will assess them and take care of them. And make sure that you assess their past medical information. Make sure that you look at their medications, know what they're on. It gives you a very quick peek into some medical history that they may have forgotten to tell you. I want to show you a little 5-minute video that will kind of show you the patient I talked about earlier, who I just think is adorable. A patient that's over 60. She has been a model her entire adult life. In the video you are seeing, we are going to be doing her second treatment. And actually, she's probably driving here from an hour and a half away where she lives. But I think after this whole webinar is done, we'll be seeing her. And I'm going to do another layer on her. But you're going to be seeing the second layer I'm going to be doing in this short little 5-minute video. So you can kind of see how I have a tendency to use cannulas. I use them very gently. And I like the cannula to flow and find its own way through the tissue rather than pop or shove it through something. So here we go. You're going to see this next video. In this demonstration video, you will see how to replace age-related volume loss in the face with Renuva. This video demonstrates Renuva using a cannula. You need to first make a porthole in the approximate location of where you want the cannula to go. Now, you will want to look at panfacial volume loss and where the patient has lost fat. That is exactly where we want to put Renuva. You can put it in the superficial fat pads, and you can even put it in the deep fat pads if they need it. You make a porthole just past the dermis. It does not need to go deep. It can go just past the dermis. Let it sit there for a moment. Let the skin kind of stretch around it. Then we can take that out and place the cannula very gently into the hole that we just made. So the cannula is in the subdermal plane. We don't want this in the dermis. We want this subdermal, even superficial subcutaneous tissue, because we want this Renuva to help replace natural fat that she's lost with aging. This is going to go in layers, and we gently let the cannula find its way through the tissue. We don't want to force it. We want to be very, very gentle. You can put your thumb before the cannula and after the cannula to flatten out the planes of tissue so that the cannula might glide much more easily on its own as we inject the Renuva. In thin little layers, in a fan motion, going all the way up to here, and I am only subdermal, like in the superficial sub-Q. So you want to stay in the subdermal tissue, just below the superficial sub-Q, and inject just small threads of the Renuva as you go. When you want to aspirate, you can come up very gently and let your cannula go through the tissue very, very gently. Don't force it. Just let it go through very, very gently. This is what takes a little bit longer with a cannula, but that's what makes it a little bit safer. We don't want to go through any big vessels. So when you want to aspirate, you can simply hold the syringe and pull back with 2 fingers. If you can see what I'm doing, kind of pull back with 2 fingers and aspirate before you inject. And that works very, very, very well. One way that makes it a little bit easier for you to do aspirations is when the needle or cannula is in the tissue, you can control it very well by pulling back and then injecting. It's really important to know your anatomy, know the depths of tissue you're injecting in, and know where a lot of these ligamentaceous attachments occur. It's almost like your road map when you are injecting. This preauricular area is a much, much bigger area that is very important for you to recognize. If we lose fat from the lateral line of ligaments down, it is going to cause a drop in facial tissue to the front. So we are going to have an exacerbation in the nasolabial fold and the marionette line. If we provide volume, it's going to give that patient a little bit of lift and take some weight off of the forward component of the face. So prior to doing a lot of treatments in the front of the face, it's important to make sure that volume is replaced laterally. So as you are injecting the Renuva, pay attention to what they look like. Pay attention to what it looks like when they have this added volume. It's going to drop down. This is slowly going to be absorbed before it actually starts growing their own tissue. But we can get a really nice gauge on what the forward face is going to look like, how the smile lines are going to react, how they're going to look with a little more volume when we replace the superficial fat pads out here. Keep in mind we have a parotid gland in this area that is fairly superficial, so do not inject deeply in this area. The external carotid doesn't go superficial until about 1 centimeter above the tragus, so we're not really going to hit this area. This area, if you go superficial, you're not going to hit the external carotid. There's actually a porthole here, so we are going to superficially just thread it gently up into the tissue in the preauricular area. And it's very important to stay very gentle with cannulas. Do not force them. They can be as dangerous as needles if you force them or shove them. So make it very, very gentle. We can reintroduce the cannula as many times as you want into that port site and replenish the volume as much as we need to. So just keep assessing that patient. Keep looking at where you need to put the volume. It might be just small amounts. We need to kind of look at these little lumps and bumps if there are small ones, and don't worry too much about that. We just let it slide very, very gently, curtain rod the skin up onto it so we can get up on the zygoma. We aspirate and just inject a very small thread down. Beautiful. Now, as an experienced injector, you know how important it is to set a patient's proper expectations. This is similar to fertilizer, which is initially placed and then the results are seen over time. The number of sessions is dependent upon the patient's pre-existing volume loss. You are going to see 80% of the results within 3 months and 100% at 6 months. You can bring your patients back every 3 to 6 months for re-evaluation and assessment. At that time, you can discuss with your patient if more treatments may be needed. Okay, so hopefully that gave you a little peek into how I kind of use my cannula, and I love cannulas, but to kind of gently place the Renuva into that superficial sub-Q plane of tissue where it just grows beautifully. And I didn't show that in that one video, but we can certainly take a cannula and come laterally and go down into that prezygomatic space, into the deep fat pad, which I do frequently, and it gives people a little bit softer midface. So depending on what the patient needs, you can kind of put in any of those planes. You kind of the world is yours as far as where someone needs to have their face balanced and where they need to have the volume placed, which is really nice. So this is one patient that is courtesy of Lisa Goodman. She's a PA that's founder of Good Skin. And this patient had 4 treatments of Renuva. She had 7.5 cc's per treatment and a total of 4. So this is over a year that this was done. And generally 7.5 cc's is one of the larger amounts, but usually I do about 6 cc's per treatment on most of my patients. This Renuva comes in 1.5 cc and 3 cc syringes. I generally will pick 3 cc's per side on most of my patients, and that's kind of where I gauge where I'm going to be going. So patients know that it's going to be a slow road, and I always say this is kind of like a marathon, not a sprint. So they understand that it's going to be small improvements over time, and I tell them you're going to look better in a year than you do now. That's what I tell everybody. And if you look at this patient, wow, she looks better in a year than she did then. So you guys have a lot of questions, I think.
So we do have some questions.
Good.
So first of all, could you speak to the video? When you're injecting in the face, do you blend it all, and do you use anesthetic?
I do. So Renuva, when it first comes, it comes almost like a beige toothpaste. It's a little bit of a thicker material. And to ease my injection, what I do is I do blend it down with saline and plain lidocaine so that it becomes more of a thinner whipped cream. And so when I inject it, it's more of a thinner whipped cream. And I think every injector finds what mix they kind of like. We kind of look at how often does a cannula or needle plug? Does it kind of get plugged with something? If it does, and we kind of thin it down a little bit more. But as long as we give the volume that we need to give, I don't think it matters on how we reconstitute or kind of add things with it. As long as we're giving that 3 cc's of Renuva per side, if we want to blend that down into 12 cc's or 15 cc's, you're still going to get the amount of allograft in that injection.
That's great. Thanks. And that's an interesting point to mention is that for some folks that prefer to blend 1-to-1, 2-to-1, 3-to-1 or more, you're only putting in the same amount of Renuva. So if you put in 10 cc's of a blended Renuva with only 1.5 cc's of Renuva, you should really only expect to get 1.5 cc's in the end.
Right.
So tell me, what about patients that have already experienced other fillers? If they've already had treatments of, say, HAs, have you used Renuva with those patients?
I do all the time. I do almost every day. It doesn't matter to me if they've had HAs. Sometimes I'll ultrasound them real quick to kind of peek and see what layer it's in. But I don't have any problem putting Renuva in those areas. I know that it's going to stimulate fat production wherever I put it. And the HA is going to slowly dissipate and be absorbed over time as new fat grows. So I've not had a problem with that at all.
Got it. Thank you. So we took a look at the Lisa Goodman patient, and the results were amazing. The question is, and I don't know if we know the answer to this, is if 7.5 milliliters were used per treatment, does that include the blending or the dilution?
I don't think it does, because when I do 3 mLs of Renuva, I blend it up to 12 cc's. So that I'm putting in 12 cc's of product into each side. So it's saline, lidocaine, and Renuva. So I don't want my cannula to clog. So I think that's probably looking at, like I would tell someone I'm putting in 6 cc's. I might mix it with 12 cc's or 10 cc's of saline, but it's still just that bottom line amount that I get in the syringe of the Renuva.
This next question is related to pricing and also what fees you might charge. So just so that I can state the facts, Renuva comes in a 1.5 and 3 cc, and it's priced at $592 and $1136. So given that cost, that list price, how do you recommend some providers charge the patient?
I'll tell you what I do personally is that I charge per cc. I charge $1,000 per cc to inject it. The product is free. Let me say that one more time. The product is free, and I state that very clearly to my patients, but I charge an injection fee. Why do I say the product's free, John?
Well, because we don't charge for human tissue, right? It's a service.
We can't charge
fee.
for human tissue.
Right.
Yeah. So
That
we
makes
can't charge
sense.
for human tissue. So I think we need to be very careful legally. And I charge $1,000 per cc to inject it. So if somebody's doing 6 cc's, it's $6,000 for their face. I do 6 cc's in the hands frequently, and that's $6,000 per session in the hands too.
Excellent. That's a great point that we in allograft tissues, we use different language, and we provide injectors with patient consult language, so you can accurately describe what Renuva is while being respectful to the donor. How do you present Renuva to patients, and what do you think is the ideal patient?
That is such a good question. Thank you. That is a good question, whoever asked that. When I sit down with my patients and I tell them about Renuva, first thing I do is I say, I want you to know this is donor tissue. This is donor tissue. And they might go, oh, and I'll say, but let me tell you about it. I have been back to their offices, and I know how this is made. And I know the thorough process and sterilization process that this goes through. And I say, it's kind of like I'm taking a beehive out of like honeycomb out of a beehive. And the Renuva is kind of like the honeycomb, and the fat is the honey. So MTF is taking all the fat away from it and just leaving that honeycomb, which is just the scaffolding. It's simply the holding place for it. And then sterilizing it, taking out the DNA, and then giving us that soft toothpaste-like product that then we can put in that honeycomb so your body can grow the honey on that honeycomb scaffolding. And when they understand that only 2% of donors are accepted to MTF, that means a lot. When I heard that, I was like, whoa, okay, this company has high standards. And I was really, really not only impressed, but doubly impressed with that, because I think that when MTF doesn't take 98% of the donors that are offered to them, that tells me they have high standards. So I feel more comfortable giving this to my patients and myself. I've had Renuva, so I feel very comfortable getting it and treating my patients with it because of that.
That's excellent. Thank you so much. Now, in the video, you used a cannula. Some people are more comfortable with needles, some like cannulas. So is there any rule of thumb here?
No, I think it's whatever you're more comfortable with. I'm a cannula person because they're 77% safer in the right hands. But my cannula I used in the video was a 22 gauge, 2 3/4 inch cannula. That's what I used. It goes through a 22 gauge much easier. You can also use like a 21 gauge, 1.5 inch needle if you want to do that, or a 20 gauge. It flows through that a little bit easier. I wouldn't pick too small of a needle because it won't flow through it real easily. So I find that the planes of tissue I need to go into, which is sub-Q, the cannulas have a tendency to glide pretty easily through those.
So we know that the data for Renuva, and there's a number of studies where we've studied Renuva in different ways, but the question comes up about how much survival rate of Renuva is there compared to autologous fat. So the data supports that you're going to get anywhere from 40 to 60% volume retention, depending on the amount of volume used. If you use too little Renuva, it seems as if Renuva doesn't have the same reaction or doesn't have the same result. So a little more Renuva sometimes goes a longer way. We also recommend injecting to correction. So in your experience, when you're injecting, how do you treat the patient? And you mentioned that you might bring them back for another treatment or two. So how do you approach that?
I do. So if they have a pretty thin face and I know they're going to need several sessions, I'll bring them back in 3 months because I know it hasn't fully grown, but I know I see probably 70, 80% of the volume that's going to grow. But I do also tell them, like, look, I got this 3 cc syringe, but you're only going to grow a cc and a half of the fat. You're only going to grow about half of what I'm putting in back in volume. And that's a blueberry and a half. 1.5 cc's is about 1.5 blueberries. So I try to explain to my patient, look, if I smear 1.5 blueberries around your face, you might not see a big difference. But if I do it several times, you're going to see a difference. So it's just getting the patients into that mentality, and it's educating, taking the time to educate them, because this is something new. And it's something that we have to know about this to be able to educate our patients about it.
That's awesome. Now, as far as setting expectations and the benefits we see from Renuva, we know that there are some studies that suggest that autologous fat has some regenerative capabilities, that actually we see improvements in collagen, elastin, and just overall skin quality. Now, we're studying this at MTF, and we're going to have data to share. But I'm just saying, anecdotally, do you notice a glow or a change in the skin tone?
Huge. When you think about it, new fat cells are going to have stem cells. Stem cells are going to help with fibroblasts and collagen growth. So it makes sense to me that we are hitting the entire gambit when we do Renuva. We're going to grow the fat. And I'm sure you guys are going to see that we are going to have new little stem cells that are going to go out there and help with dermal thickening and going to be helping with collagen stimulation. So I can't wait to see this, because theoretically, when we're looking at pathophysiology, we know this happens anyway with fat cells. They have a lot of good stem cells. So we'll see. But I can't wait till that comes out. I'm really happy to see this. One question I saw on there was looking at survival. And I mentioned that we get about half the syringe, the volume back in growth. Now, when you're looking at a fat transfer, like you're doing a fat, whatever, like BBL or whatever you're doing, there's always a risk of that fat getting something. When you're putting globs of fat in there, it's got to grow its own circulation. You've got to have neovascularization that is going to go in there and give circulation and oxygen to those new cells and the transferred fat cells. There's always a risk that in the middle of that transfer, there could be necrosis, because you could have just dead tissue that didn't get the circulation that it should have. And then that's why sometimes we get 30 to 50% of the transferred fat that dies. So we never know how much is going to survive with a fat transfer. We don't. It depends on how it's harvested, how it's treated, and how much is put in. So what's interesting is with Renuva, we are putting this in layers. The body is growing the circulation and giving it tissue to grow on. Basically, we're giving it its nourishment while it's growing. So we don't have fat necrosis, and it's incredibly controllable. This treatment is very controllable. This product's phenomenal as far as being able to kind of know where we want to go and take baby steps with our patients. And they appreciate the fact that we can assess them and we can do it again. Then we wait and we assess them and we do it again. And patients really appreciate that personalized approach. They always appreciate that. I appreciate that when I'm with a provider.
That's such an amazing statement. Yeah, it's true. So fat grafting is tricky. It's not predictable. And we know that Renuva can't die because there's nothing living in it. It's just the ECM matrix that's left behind. We don't add anything to Renuva. And so it's more predictable, I would think. Mm-hmm. Even as long, someone said in fat grafting, if you could just guarantee I'll get 50%, I'll be happy, because I just want to know what I'm going to end up with. And with Renuva, you have that.
Right. Absolutely.
So some of these things are off label or haven't been studied, but there's questions about PRP and Renuva. There's questions about maybe other biostimulatories in Renuva. And although maybe you have or haven't tried Renuva in those ways, there may be providers you've talked to that have chosen to do that. Any comments about mixing products or therapies?
I'm so conservative. I'm like the most careful person around. Unless I kind of see research on it, I have a tendency to kind of be a little cautious about it. PRP is great, but PRP is extremely pro-inflammatory. So if I were to mix PRP with my Renuva, I'm going to put a very pro-inflammatory component in there, and the body's already going to react to something that's there and kind of go, what is this? What do I need to do with this? And I don't know if I want to compound my variables and add another inflammatory component in there. So I probably would not do that. I have a couple times mixed it with some PLLA. I didn't see any difference. So I stopped pretty quickly mixing them with anything because I really didn't see a difference. I didn't see more volume or anything.
In some ways, if Renuva works by itself, why mess with it? Why mix it with anything?
Exactly. And you're on to exactly what my thought was. I see great skin glow and dermal texture and other things with Renuva that I also saw with PLLA. So I'm like, okay, why am I mixing these? Because I'm seeing all that with Renuva already. So that's why I just stopped mixing them.
In your experience, or as you've heard, because I can respond too, because I see all the complaint data, have you seen any complications with Renuva? Is there anything special you need to consider when injecting Renuva compared to other things? Have you seen granulomas or other things long-term?
I had one patient that had a small little lump, but she ended up having an infection shortly after she had the Renuva placed. So like I said, the body's going to respond to anything that is foreign. And if you have an infection, it's going to travel right to a foreign body. That's the first place it's going to go. Could be a knee implant, could be a shoulder implant, could be fillers. So I think that was probably the reason why we did that. I put a couple little milligrams of Kenalog in there and it went away within a couple days. So it was just like something small, like a little nodule, but I think it was probably something that was more related to an infection the patient had that kind of traveled to that area. But in general, no, really have not had issues. This has been something easy, safe. The patients love it. Patients come back and get more. I know it can be, people are like, wow, it's expensive. It is, and we have to remember too, everybody, you guys are all injectors out there. We have to remember that this is not a soft tissue filler that can be made by thousands of syringes of batches. This is from donors. So if people are saying, give me stuff to train with, or give me some free syringes, it's not that easy. And I don't think we can expect that. I think that it's something, that's why we only want injectors who really have good experience. I mean, like basically, if you're an elite injector, you don't need training to inject this. You already know how to inject biostimulants. You already know your anatomy, and you can kind of, where your fat pads are, you can take it and go. So I think that it's really important regarding that we kind of make sure that we have that education and that background. Really important.
Sure. I just want to jump in. I've got a couple of comments to make, and then we have just one or two questions left. There's a question about, can Renuva be used in a 15-year-old person with a concavity in the glabella? And so you can comment on that anatomy in particular. That was the result of a hemiangioma when she was just an infant. And the comment that I would say is, we know that Renuva is wonderful for aesthetics, but it's also been used safely in pediatrics with cleft palate or craniofacial defects. So it certainly can create balance in the face, whether it's for aesthetics or just trying to make people more symmetrical and just like they want to be.
Yeah, in that case, in the glabella, I would say absolutely not. And why? Because any soft tissue fillers, which this is not a filler, but this is still something thicker you're putting in there, that's the highest risk area for blindness. I wouldn't even go there with it. I would think of something else, skin grafting, whatever, something else there. But I wouldn't put any filler or Renuva or anything in a glabellar area. So I think we just have to look at safety first. But the other thing I wanted to mention was, it's not just face and hands we can put this in, you guys. If somebody has a deficit on their behind, or they need a little softening, if somebody has a little divot from liposuction, it's perfect. If somebody has a little divot from like a surgical scar, perfect. Breast augmentation, perfect. This is great to give somebody a little bit of that softness when they've lost it, if there's a little post-surgical thing. So this is also really good for kind of tweaking things too.
There's been two questions about New York State, and I just wanted to address that. New York State has a different regulatory perspective of Renuva. Renuva is an allograft tissue in 49 states, and in New York, they see things a little differently. It's not unique to MTF Biologics.
Oh, hi, Lori. Sorry. Oh my gosh, you're in the middle of something. I can wait out here, okay? I'll just wait out here while you finish up.
No, come here. Oh, come here.
Oh, sorry.
Oh my gosh.
Oh,
okay, you guys, this is so cute.
Oh, no. Okay.
This is Allison. Hi, sweet. This is our model.
We're going to do the treatment, right?
Yes, we're going to do the treatment. No, after. We're going to do it after the webinar. But come sit here. Take my chair.
Allison.
Oh my gosh. There's John.
John,
Allison.
hi.
Yeah, cute. You're here early. But I was just talking about, we're going to do her third layer.
Yeah.
We're going to do her third layer. And she was going to come after the webinar. But here she is. So I love that you're here. Thank you. Oh my goodness. I love it. Thanks for even popping in.
Yeah, no. Hi, guys. John, I'm glad to see you. Hi, everyone.
Who we're talking to right now are probably some of the country's best injectors. So these are really good injectors who already do a lot of injecting, and they want more information on Renuva. So I love that you're here. Okay. I want you to tell them kind of, they saw your video. We showed the video of me doing your second treatment.
That was something.
Tell them kind of what you felt. What was your experience? What do you, I see your difference. What do you, tell me what you think.
Well, it's been an incredible journey. I just want to start just quickly with a background. I've been modeling for well over 40 years, a long time. And so I've been in the business a long time. But as I've gotten older, I've had, several companies kind of, approach me and say, would I do some kind of injectables? And I was like, no, I'm really not interested in fillers or that because, aging is part of the process and it's been fine. And I just didn't want to do anything that would really change me. So I declined that. And then Renuva reached out and they said, well, would I be interested in perhaps doing something in my hands? Well, my hands truly were showing signs of aging. They really were. And so I thought, well, maybe. So I asked, could I speak with someone? And I got to talk to Lori. And she kind of walked me through it and made me feel really comfortable. And I said, you know what, I'm going to do it. So I've had 3 treatments in my hands, and it's been incredible. I'm so happy with the results. And if you go on Renuva's social media website, anyway, they've chronicled it all, which has been really great. But truly, it's shown really great results. And then the wonderful people at Renuva approached me about maybe doing my face, and I was like, well, I'm going to have to call Lori. So I called Lori, and at this point, I really trusted her so much. And I trusted Renuva. So I was like, okay, I think I'm going to do that. And I've just been really, really so pleased because part of it is that you can do the layering. So it's subtle, it's subtle, and it over time. And so it's great. But I have to tell you something funny. So after that first face treatment, a friend had brought me. And when I went out, he was like, whoa, Allison. I was like, I know. Because, I mean, you guys know, after that, you have the treatment, you kind of look the way you're going to look about it 3 to 6 months. And I don't know. It's great. So, I mean, that was shocking. But other than that, I'd go along, my day and everything. And, people maybe said, oh, Allison, you look refreshed or, drinking a lot of water and all that. But something that really stuck with me is I have this one makeup artist that I've been working with pretty much my entire career. And he said, Allison, what are you doing? Like, you just look amazing. And I don't know. I mean, it shows. And again, it's subtle. So it's not like clients are like, wow, you've done something crazy. It just is a subtle softness. And I don't know. I've been so comfortable, and I really am so grateful for Lori. And I'm sure, we're talking to all the elite injectors here. So I'm sure that your people like me feel that same way about you. But it's been really wonderful. The people at Renuva have been great. And I also love the fact that it's a nonprofit company that gives back so much, and all their money goes to making like new things that help people. I mean, I don't know, it speaks to me. So besides being really pleased about the results, and I do want to say it has helped my business.
We love Renuva, and we really see it working well in small volume applications, but the market wants what the market wants. So people ask us from time to time, and we've seen it. People ask, like, is this a good treatment for, say, augmenting the body, even doing, say, mini BBLs or body shaping? What do you think about that, Lori?
Absolutely. Absolutely. Because we have a lot of biostimulants out there that will grow everything but fat. And when people, what's in our butt? Fat, it's mostly fat and muscle. So I think it's a great product to help shape and contour an area. So yeah, absolutely works great in the booty.
Now, that Renuva is a premium offering and it's priced appropriately. So larger volumes may not be for everyone. It may be cost prohibitive, but there may be creative ways that some providers, I'm not asking, but some providers might price things differently based on time to inject and covering the cost of the product. So I'll leave it there. And you can always reach out to us to connect with providers that are doing larger volume applications. When you use lidocaine or some other anesthetic, Lori, that's off label for us to recommend, but for a provider, it's perfectly fine. How much lidocaine or anesthetic do you use?
I use plain lido because if there's any occlusion or any vascular event that might happen, I want to see it right away. I want to see any blanching. So I don't want any epi to blanch the tissue. So when I take 3 cc's of Renuva, I will take about 8 cc's of saline and just 1 of lidocaine with just plain lidocaine. So I just put maybe 1.5 cc's of plain lidocaine in there, mix it up with the little red mixers that we have, the little female adapter, mix it up in a couple 10 cc syringes. And I end up with about 12 cc's, and that works out really well. So the most of it's normal saline, and I add maybe a cc and a half of plain lidocaine, 1% or 2%.
There's questions about complications like occlusions or embolisms. How would you treat vascular occlusion? I know that there have been a couple of reports, and they were treated by medical professionals that are able to treat these things. If you were to, I guess the first thing starts with great technique. So could you remind us what is safe technique? And then should someone have some type of occlusion, what's most important to do while they're there in the chair?
A vascular event, it could be intra-arterial, or it could be something that's perforate or arterial vasospasms. It could be either. It can happen with any soft tissue filler or biostimulant or biologic. So I use a cannula to help reduce that by, like I said, 77%. A 22 gauge cannula is terrific. You just want to force it. You want to be very gentle with it. A lot of times when I'm going more superficially, I don't have to worry about any big arteries when I'm very superficial. When I'm going deeper, I'm very, very gentle with my cannula. I don't pop through anything. I let it find its way through the tissue gently. So I always say it's kind of like when we're using a cannula, it's like we're knocking on a door. We're knocking, and there's going to be a doggy door in that door. And it's going to let us slide through very gently. And we're not traumatizing tissue. And if it slides through like butter, we didn't go through an artery. If there is some type of vascular occlusion, which knock on wood, I've never had one, what would I do? I would massage the area, warm the area. I would throw Hylenex in there. I would take hyaluronidase and try to just break up any natural hyaluronic acid that might be in there. As far as an emboli, we're not injecting fat, we're injecting the matrix. So this matrix doesn't have fat per se on it. So it's from natural tissue. So everything we inject might have a risk of a vascular event, but I think being as careful as we can be, I like cannulas because they are quite a bit safer. Be very gentle, very thoughtful, and know your anatomy. Know where the arteries are, know the depths and where they're at, and then move them 20% because they're never the same in both people. But I think the tip of our cannula needs to be like our seeing eye cane, and we are just tapping around. We're trying to feel for little landmines, and we try to avoid them.
What a great way to end the program. This was fantastic. What a surprise. But Allison, it's great to see you, and you're looking fabulous. You too, Lori. I just wanted to thank you both for what a wonderful program this has been. I also want to encourage people to follow @myrenuva on social media. You can go to myrenuva.com to find out more about Renuva and to learn about all the wonderful educational and marketing assets we have available by logging into the provider portal. And then, of course, tag myrenuva. And if you have any questions, you can send them to me or to renuva@myrenuva.com, and we'll be sure to answer them quickly.
Thank you, John. Thank you so much.
Thanks,
Thank you for watching,
John.
everybody.